The time right now is 8:37 on this Thursday morning. You know, throughout the month, we have been highlighting breast cancer awareness. It is Breast Cancer Awareness Month. We've talked to survivors. We've tried to bring you everything pretty much you need to know about being proactive and detecting it, trying to keep your chances lower of developing it, and what to do if you end up getting it. And today we are here talking with a breast surgeon from Loveless Medical Group about mammographies or mammograms and other forms of breast cancer screenings that are out there that you might not be too familiar with. We have Dr. Calvin Ridgway here. Thank you so much for joining us this morning, Dr. Ridgway. Okay, so let's start off by talking about mammography. That's, I think, the more common. A lot of folks, I think, are more familiar with it. But nonetheless, let's remind folks what it is and what the current guidelines are.
Well, it's important to start your screening mammograms every year at age 40.
Okay.
And it's important to do this because the average age of breast cancer patients is only 51. So it's important to start screening in that decade before age 51 to pick up any precancers or small cancers at that time.
And is it a yearly, is this something that we should be doing every year, once a year?
It should be done every year. Breast cancer is kind of a slow-moving thing, so it's important to do it every year, and then you can pick up those tiny changes in the mammogram.
You know, we've talked to quite a few survivors this month. A lot of them have actually gotten breast cancer before the age of 40. And I guess what could you share with us in terms of letting folks at home know about how to be more proactive and maybe get screening before that age? Like, what are some of the indicators?
Well, that is true. About 1 out of 4 new breast cancer patients will be in that younger age group. So it is important for young women to increase their awareness by doing a monthly breast self-exam beginning at about age 20. And then in the younger age group, they should still get doctor breast exams about every 2 to 3 years.
Okay.
The other thing that's important is talking with your family about your family history, because sometimes that will set off red flags that indicate we need to do genetic testing and then more intense screening for that group of women. I
know there's some folks that can definitely become apprehensive about getting screened. What kind of tips would you have for them before and after a screening, a procedure?
Well, again, it's important to be aware of your family history when you go in. There'll be a questionnaire even in the x-ray department about your family history. They will recommend that you don't wear deodorant for the exam because some of it contains aluminum that may interfere with the x-rays.
Okay.
And then understand that if there is any discomfort, that frequently the technicians can add some padding or adjust the positioning for you, and it is only for a few seconds, but it may prevent a long time of trouble for
that's an excellent point, doctor. What about MRI scans? Are these necessary at all?
MRI scans are very important. They're very good for looking at soft tissues, including the breast tissue. We don't use them for screening for general patients because they're a little bit too sensitive and they may pick up things that look suspicious and require a lot of other testing, even biopsies and operations, but then turn out to be okay.
So it's not as common.
It's not as common. We use it for folks that have a diagnosis of breast cancer, and we also use it for women that we can identify as part of a high-risk group.
Interesting. Okay, I want to ask you about men. Men can develop breast cancer. What advice would you have for gentlemen out there?
Well, again, for the men, it's important for them also to understand their family history.
Okay, that's a big one.
If a man has a breast cancer, it may more often be related to the genetic kind. That BRCA gene that sometimes gets passed down in the family. And it's easy enough for a man to do a breast self-exam as well. And if you do feel a lump, you should get in and see the doctor and get it checked out.
What about thermography? We mentioned that earlier in the show. What is this? Because we haven't heard too much about this type of screening.
Well, it's not really advocated for screening or diagnosis of breast cancer. It's good to bring it up. I get asked about it a fair amount. It is an attempt to identify differences in temperature in the tissues and get an infrared type of picture. But basically, it's just never been proven effective for screening or diagnosis of breast cancer. So really, I would not advise anyone to spend their money on thermography.
Right. Do the mammogram.
Right. Do the mammogram
at the age of
instead,
40,
and of course talk to your doctor.
Thank you, Dr. Ridgway, for coming on board and sharing this information with us. For a recap of all of this, for more information, please go to our website, krqe.com. We've got a link for you there.